Hello everyone, this is Dr. Anirban Pal, and today I am going to talk about mindfulness in chronic pain. So I am going to say something very different today. So just listen to the next few minutes. So as doctors, we are treating pain patients, and how we actually treat the pain patients. We take a history, we do a examination, and then we order some investigations. We reach to a provisional diagnosis about the cause of pain. Then we prescribe some medicines, and then if needed, we do some interventions or procedures. So there is no problem with this scheme, and this is the usual scheme of the whole treatment we are following. Now, if we look into the revised definition of pain by IASP in 2020, we will see that it defines pain as a personal experience influenced by biological, psychological, and social factors. And a very important statement is being made that through their life experience, individuals learn the concept of pain. So we are taking care of the biological factors. So do you as a physician take care of the psychological or the social factors of your patient? Just keep your hands over your heart and give an honest answer. I think for most of the physicians and even for others, the answer will be a no. So if we look into chronic pain in a little detail, or if we go deeper, we will see that there are lots of factors which are associated, which are more important than the chronic pain itself. Suppose a patient who is suffering from chronic pain, his job is in danger. He is at the verge of losing his job. So his finances are going to be affected. So that is causing more distress than the pain itself. Or maybe the patient is a housewife who has a major role to play in the daily course. And as she is unable to function properly in her house, her role in the family may change. And as a person complains of the pain again and again, and he or she has to be taken to the medical care, so we see that over a period of time, those in the family, there is a loss of support to that person. It is very common. And we see that the relationships with the people who are very close by, all the relationships gets affected. And this includes even the psychosexual relationships. A person with a severe back pain, the sexual life is equally affected. And a person with severe pain slowly withdraws himself or herself from the society, doesn't feel well to interact with his family and friends. So it is very important to understand that our patients may or may not be suffering from psychiatric problems, but almost every one of them are facing some psychosocial challenges. So the patient need not have a psychiatric problem. A patient coming with chronic pain need not have a psychiatric problem, but is facing lots of psychosocial challenges which he or she has to deal with, which even he cannot express to his physician. And if you think that your patient is having a psychiatric problem, don't hesitate to refer to a psychiatrist. So the important question is, what as a physician we can actually do for the psychological as well as the social well-being of our patients. So those who think that yes, you do something to take care of these important aspects of chronic pain patients, you actually have only three options. One is that you do something yourself for your patient, but here the time is a constraint. So to deal with this very deep matters and complex matters, you need a lot of time. The next is the training, that how well equipped are we as doctors or physicians to deal with this, because this is not included in our curriculums and we may think that we are doing something, but that may not be actually beneficial to the patient. The next option is referring the patient to a psychologist. Here also there are major issues, because who is a proper psychologist and who is a proper person who can actually help this pain patient, it's very vague in our country, because everyone claims to be a counselor or a psychologist. And once you say to your patient to go a psychologist, there is a taboo. The patient, most of the patients, they refuse or they don't take it well that he or she is being referred to a psychologist. So the availability of the psychologist is also very compromised. And when a person will be giving quality time to a patient, obviously there will be financial issues. There will be a number of sessions or counselings which will going to happen, and the finance is definitely going to come in. So the third option can be something called mindfulness. So when I talk about mindfulness, there is three very important things to know about this. What is it? What is this mindfulness thing? And how helpful is this for the chronic pain patients? And as doctors or physicians, it is very important because we are in a science. So what are the research evidences for this thing? So coming to the first part of it, what is it? In very simple words, this is a form of mind training. Mindfulness is a form of mind training. It has a formal definition which says that it is to purposefully keep the mind in the present moment in a non-judgmental and non-reactive manner. And again, in very simple words, it's a self-help tool to see life from a new perspective. So in very short, just let me explain the definition. So we are physically present in our bodies. So I am here, I am saying something, and maybe you are listening. So we are physically present as bodies, but our minds are not here. So even when you are listening to this, your mind is going here and there. Your mind may be going to the future, thinking that what next to do, when will this talk end, or it is thinking about some past event. So mindfulness is a sort of mind training which helps to keep the mind in the present moment along with the body. And a lot of people think that how life can change. Actually, the life doesn't change with mindfulness, but it brings in a new perspective of looking into life. So here also I can give you a very short example. Suppose there is a park near your house. So when you look at the park in the night time, it is dark, it is dull, nothing is quite visible in the park. And again in the morning, when you look at the park, the same park changes. There are beautiful trees, there are beautiful flowers, and lots of things which you like about the park. So the park remaining the same, but your way of looking into that locality, that changes. It brings in a new perspective. So life remains the same, but the ways of looking into the life completely changes by practicing mindfulness. The next question which comes to the mind, that how to learn this. The most famous of the programs to learn mindfulness is named as the mindfulness based stress reduction. This was first introduced in a US medical school in 1979. This was an 8-week program of weekly sessions. So there were 8 sessions in this program. And these were group sessions, small group of people from the community used to come and learn this. And it was first applied in chronic pain patients. Later, this program got modified to other programs, and after that, the online versions are also available. Now, many of you will be astonished to know that this mindfulness, is practiced in the schools, colleges, and the offices of the Western countries. It's a form of mind training to help to keep your mind healthy for your mental well-being. So this is even incorporated in the curriculum of the schools so that everyone can practice this and can take care of their minds. Now comes the next 2 questions, that whether this is helpful in chronic pain patients and what are the research evidences. So it has been seen that mindfulness has lots of effect. It reduces the pain intensity, it reduces the negative thinking, it reduces the fear about pain. So helps a person with better coping with pain. So in addition to relieving the pain, it is actually affecting multiple dimensions of our existence. It decreases the stress, it calms the body, it reduces the anxiety, it integrates the emotions. So it is affecting the whole person and is changing the quality of life. Now, what is the mechanism of action? How is these things happening? So there was a very famous article which got published in Pain Reports in 2019, and there are also other articles which discuss how it actually acts. The mechanism of action, the main mechanism of action, is called the reappraisal mechanism, where there is a higher order regulation of low-level nociceptive neural targets. In addition, there are other mechanisms which are also taking part in the brain and helping this mindfulness to act. Now coming to the last part of it, what are the research evidences? So if you go into this database PubMed and just type that mindfulness in chronic pain, you will find there are already around 900 articles which are published and in this database. So the amount of research is quite large. Here I would like to mention about a study which was published in 2008, around 15 years back, which says that this randomized controlled trial, which was conducted in chronic low back pain in older adults and published in this famous journal called Pain, it concludes that this mindfulness may lead to improvement in pain acceptance and physical function. Then there was a systemic review and meta-analysis published in 2016, which says that mindfulness meditation improves pain and depression symptoms and the quality of life. In 2017, mindfulness was included in the clinical practice guidelines of American College of Physicians. So it is already included in the treatment guidelines of chronic low back pain of the American College of Physicians. And even recently, in February 2013, there was a study published in the Journal of Pain. So it's a very hot and happening thing with so many researchers coming up, and a lot of new informations are coming up about this mindfulness meditation and its effect on chronic pain patients. Now coming to the studies in Indian population. So there are very less studies, and here comes my little contribution where we published a small study where we found that this mindfulness has a positive impact on pain intensity, chronic pain acceptance, anxiety and depression and quality of life in Indian chronic pain sufferers. In another study which we were able to publish, this was in non-pain patients where we found that mindfulness affects the mental well-being and the quality of life. Another very important study which we could publish was in the year 2022 in Indian Journal of Psychiatry, one of the very reputed medical journals, where we found that the online mindfulness program helps in stress relief. So we are working on this more and more and collaborating with different people. So recently we conducted a multi-center study on the application of mindfulness in chronic pain patients, and we hope that this is going to be published soon. Now coming to the mindfulness training, the program we are doing is a little modified version. It has 5 sessions, both in offline and online mode. The sessions are of 2-hour duration. We try to keep it affordable for everyone, and we follow it up with regular practice sessions. So, mindfulness in chronic pain, answering that any research evidence. So already there are 900 articles which are in the PubMed. It is included in the guidelines of American College of Physicians for treatment of chronic low back pain. And the research articles are published in very reputed journals like Pain. So I think this is more than enough. This, whatever I have said, because other procedures or other treatments which are being given to the chronic pain patients, they have much less evidence, scientific evidence than this mindfulness. So you can use mindfulness for yourself. It's an excellent tool for stress relief. It's very good for your mental well-being, and it helps you to connect to your peace of mind. The mindfulness is good for the patients also. It's an additional tool in pain management. It helps in better coping with chronic pain. And the psychological and the social factors which are very important in pain are taken better care of. So the take-home points from today is that mindfulness is a form of mind training. It helps in psychological, social well-being of chronic pain patients. Nearly 900 research articles already in PubMed. And it is an evidence-based method of stress relief for all of us. And there are many more benefits to be explored through research here. So we should not deprive ourselves or our patients from this blessing. Thank you all for your patient listening. Thank you.